And a very warm good afternoon to all the distinguished guests, HOIs of various institutions, and dear delegates. Optimism is the faith that leads to achievement. Nothing can be done without hope and confidence. Myself, Mrs. Gautmi, feels honored and privileged having an opportunity to be the host for today's webinar, and it gives me an immense pleasure to extend a hearty welcome on behalf of RVCN fraternity. We appreciate you all for taking time off your busy schedules and joining us. Kindly request all the delegates to mute yourselves so that we can avoid any unwanted disturbances. Dear delegates, as we are about to begin the webinar, all the delegates are requested to keep their camera off and microphones muted to avoid any unwanted disturbances. If you have any queries during the session, it can be posted in the chat box. The speaker will be able to answer it at the end of the session. Request for your kind cooperation. Breast Cancer Awareness Month has been celebrated every October since the 90s. It's called Pink October as people around the world adopt the pink color and display a pink ribbon to raise the awareness about breast health and the importance of screening for the early diagnosis of breast cancer. Now, the most commonly diagnosed cancer globally is the breast cancer. Every 50 seconds, somewhere in the world, a woman dies from breast cancer, and improvements has to be made for early detection, treatment, palliative and survivorship care, and comprehensive data collection. Despite being the most prevalent cancer in the world, estimates suggest that by 2025, 2.5 million women worldwide will die from breast cancer. And this year's theme, that is Together We Rise, is to ensure every woman has the access to the screenings she needs and the support she deserves. When we rise, we rally in screening everyone. When we raise our voice together, we help to spread the word about the importance of breast cancer screening and support. National Breast Cancer Foundation INC provides help and inspires to those affected with breast cancer by celebrating the whole month of October as a breast cancer awareness month, and each week is dedicated for certain reason. Like week 1 dedicated for education, week 2 for empowerment, week 3 for action, week 4 for community, and week 5 for hope. Without dragging here, let's start today's event. Welcoming is the noblest act of any event. By welcoming, we make the person feel amidst amongst, at home amidst us. It inspires us delightfully to be more helpful, more joyful, more thoughtful in a world we live. Now I request Ms. Namita, second year MSc Nursing student, RVCN, to welcome the beautiful gathering with a sweet aroma of happiness through the words of welcome.
Ma'am, good afternoon to each one of you present today. A beautiful smile is the best universal welcome. It can make the day a good day easily. It gives me an immense pleasure to start this auspicious occasion by heartily welcoming everybody on behalf of RBCN. I, Miss Namita, first year MSc nursing student, take this privilege in welcoming each and everyone to this program with noble cause. At the outset, first I would like to Dr. P.S. Prabhakaran, consultant surgical oncologist, Maya Multi-Speciality Hospital, Jayanagar, First Block, Bangalore, the chief guest of today's event. We are extremely delighted to have such an eminent and dynamic personality amongst us today as research person. On behalf of Arbician, we welcome you, sir. Heartily welcome. Next, I would like to acknowledge my heartily welcome to Dr. S.R. Gajendra Singh, Principal of Arbician, for his enthusiastic support, motivation, encouragement, and guidance in organizing the program. On behalf of Arbician, we welcome you, sir. Next, I bid a very warm welcome of Professor Mamta and HOD Department of Medical Surgical Nursing for today's session. On behalf of Arbician, we welcome you, ma'am. Next, I extend my amiable welcome to all HODs of various departments, faculties, and staffs of Arbician for their presence in this event and support throughout. On behalf of Arbitration, we welcome you all. Lastly, my heartfelt and warm welcome to all the participants, students of Arbitration, for their presence amidst us and joining for this event. Welcome you all once again. Hope you all have a good and useful session ahead. Have a good day and thank you.
I also welcome all the distinguished guests who have joined from various institutions for this event. Welcome you all once again from RVCN. The joyful heart sees and reads the world with a sense of freedom and graciousness. Life isn't about waiting for the storm to pass. It's about learning to dance in the rain. At the foresight, it's my great privilege and pleasure to welcome Dr. S.R. Gajendra Singh, Chairman Board of Studies UG, Principal RVC, to deliver the inaugural address to the
Everyone, Namaskara. Good afternoon, respected today's resource person, Dr. P.S. Prabhakaran sir, consultant surgical oncologist, Maya Multi-Specialty Hospital, Chandigarh, Bangalore, and respected Dr. Lingegowda sir, former registrar of Rajiv Gandhi University of Health Sciences, my dear delegates and nursing fraternity. So, Breast Cancer Awareness Month is a global healthcare event for the awareness of breast cancer, which will be celebrated for the entire month of October every year for the past 37 years. Various organizations, both global and local, come together during this month to promote the awareness campaigns and also the activities which can recognize the necessity of the early diagnosis of breast cancer and its treatment, as well as preventive tips to avoid the cancer ailments. The International Agency for Research on Cancer, that is IARC, is marking Breast Cancer Awareness Month by focusing on the need for breast cancer screening worldwide and the intergenerational effects of breast cancer deaths. In the year 2020, female breast cancer became the most commonly diagnosed cancer type, and globally about 2.26 million women were diagnosed with breast cancer, and about 6.85 lakh women died from this disease. With timely diagnosis and appropriate treatment, breast cancer is generally has a very good prognosis. However, breast cancer survival is not uniformly high around the world. There are substantial disparities in survival between underdeveloped, developing, and developed countries with different social strata. This year, 2022, the Breast Cancer Awareness Month theme is Together We Rise, through which the education and awareness of breast cancer is attempted across the world. So it is the responsibility of every healthcare professional to bring awareness among the general public regarding breast cancer, and my sincere appeal for all delegates to have good takeaways through this webinar. And also, I would like to say my heartfelt thanks to Dr. P.S. Prabhakaran sir for accepting our invitation, for being a resource person for today's webinar. Thank you. Jai Hind, Jai Karnataka Mate. Over to you, Gautami. Mrs. Gautami.
Yes, sir. Yes, sir. Thank you, sir. Thank you so much, sir, for enlightening message to all of us and giving your valuable insights on bringing awareness of breast cancer to our delegates. Thank you so much, sir. To decipher the information in view of Breast Cancer Awareness Month and to enlighten on this year's theme, Together We Rise, we have a renowned speaker amongst us for sharing his valuable knowledge and experience.
Honor and privilege to introduce such an eminent and dynamic personality present amongst us today as a resource person. Words fall short to introduce our resource person, that is Dr. P.S. Prabhakaran, consultant surgical oncologist, Maya Multi-Speciality Hospital, Jayanagar, Bengaluru. Sir has been appointed as Vice Chancellor for Sri Siddhartha University, Tumkur, and Rajiv Gandhi University of Health Sciences, Karnataka.
Sir also served as Director, Professor and Head, Department of Surgical Oncology, Kidwai Memorial Institute of Oncology. Sir has also been appointed in various national committees like Scientific Research Committee, Gujarat Cancer Research Institute, Ahmedabad, Standing Committee, Radiotherapy Development Program, Ministry of Health, Government of India, New Delhi, High Power Committee on Prevention of Disability and Effective Implementation of Rehabilitation Program for Persons with Disabilities, Government of India. Sir also served as Chairman, Evaluation Committee at Regional Cancer Center, Trivandrum, and also served as Inspector in Medical Council of India for Madras University. For Sir's outstanding contributions, Sir has received prestigious awards like Service to Humanity by Media for performing a major curative surgical procedure on an AIDS-affected patient for the first time in the country, and also received KL Gupta Memorial Award, Best Healthcare Award, and Dr. B.C. Roy Doctors Day Award for the meritorious service rendered to the mankind. Sir was also been honored by Dr. Prabha Mandal Lions Club, Bangalore, North for recognition of service to humanity in oncology, and also honored at 69th Medicon IMA Karnataka State Annual Medical Conference in recognition for distinct services to IMA and medical profession. It's my pleasure to wholeheartedly welcome you, sir, and take over the session. Thank you, sir.
Thank you. In the outset, I'd like to thank RV College of Nursing for organizing such a wonderful program. I'm really delighted to be here and grateful for all the people who attended this. In the outset, I definitely like to thank my alma mater, that is Kidwai Memorial Institute of Oncology, where I served from 1980 to 2005, wherein we used to really see cancer patients in those days in 1980s. 90% of people used to come with advanced disease. Hardly 10 to 20% will come with early disease. Over time, things have changed. Things have changed not because of treatment only, it's because of medical fraternity. I can tell the entire medical fraternity contributed to it. Coming back to today's program, I'll not talk about history and past. Really, I appreciate the initiative taken by this RV College of Nursing. Number one, today's theme, we walk together. In the sense, all the people concerned with health, that is, the health educationist or diagnostic facilities or treatment facilities or screening facilities, it should be cooperative or coordinative to act to improve the quality and quantity of life both. I believe not only for cancer patients, the entire cancer community, quality of life will always give more importance than quantity of life. Quality of life in the sense, man or human being living with dignity till its end, without any deformity, without any support. Quantity of life means you live with the support, with the disease, with the deformity. The main ideas today, awareness, education, all this due to improve the quality of life, indirectly increase the quantity of life also. Let us talk about cancer breast in India. You all should know 1 in 30, 129 to 30 women born in India most likely develop breast cancer in their lifetime. Or if you take cancer as such, they say 1 in 9 of women will develop some cancer or other in their lifetime. We are more bothered with breast cancer because this is the most common breast cancer, most common cancer affecting the female. Next, cervix. The problem is why we talk so much importance to breast cancer. It affects the younger population, which can be early diagnosed, early treated properly. They can live a complete quantity and quality of life to the extent. I can tell you, I can assure 90% of people diagnosed with early disease can live a complete normal life. This is assurance not only for me, but the entire medical fraternity throughout the world. Maybe due to various reasons, many of the people don't come with early disease. If you see in India, per se, with all that education, awareness, with government supporting, still 40 to 50% come with advanced disease. The quantity and quality of life definitely comes down from some 80 to 90% to 30 to 45%. Institution like this, whether cancer institution, non-cancer institution, everybody should organize. I always felt that you set organized program for early detection. This is what we say, team, we're walking together in the sense Start with education. Okay. Education is the first necessity to bring the people to know what it is. Number one, awareness. Once you educate them, they'll get awareness. Once you educate them, they get awareness, then you should have a screening program. The screening program, people know they might be getting cancer or they're possibly getting cancer. They should come for screening. Once screening is done, definitely it will be early detection. Further, only if early detection comes, 90% of people can come with early disease, definitely they can treat it. Wherein we can assure 80 to 90% people can get cured and live normal life. That should be my introduction. I think let us have an interactive section with people who like to ask or who like to participate in this or like to contribute something to this. Thank you. Thank you for the organizers. Yes, Dr. Anita. Anita can take over. You want something? Yeah.
Hello, sir.
Yeah, tell me, Anita.
Yes, sir. So you can take a little bit about the breast cancer, how to detect it and all those things, sir.
Okay. No, I thought it will come from the public or other side. Okay. First, that's what I said. Before talking about breast cancer, let us have education first. People should know what are the problem. Why should they come to a doctor at all? See, in India, we say over time, breast cancer is occupied in female population, number one place. Why? It's because of, number one, the sedentary life of women, especially come to female younger population, sedentary life, imbalanced diet, to some extent, alcohol also they blame, early menstruation, late menopause, late marriage, late childhood, not breastfed. All these are the major causes for number of increasing breast cancers. We can definitely go through one by one and see that the incidence can be reduced. See, the problem is we may not be able to bring down to zero. The main aim of this program is to bring down the early stages and bring down the incidence. Okay. Now, let us not bother about how do you treat, what you treat and all. The screening education program. I think all the medical institutions, whether it's nursing institution, paramedical institution or medical college, they all should have a separate program for female, especially rural population. The problem of the rural population, lack of awareness, lack of facilities, and the lack of people support also. In this, I always say Government of India and most of the cancer institutes and the private institutions are really participating to bring it back a lot of people to this within this gamut of early detection, early diagnosis. See, once I tell you, by and large, breast cancer, we make it 2-3 stages. Number one is early cancer, locally advanced breast cancer, and metastatic cancer. Let me not go to subgroups. The major division is early breast cancer, locally advanced breast cancer, advanced breast cancer. I'll define what is early breast cancer. We say stage 1 stage, that is breast cancer confined to the breast, not spread to the chest wall or any other region. This patient might have 1 or 2 axillary lymph nodes. Few axillary, that doesn't matter at all. Whereas locally advanced breast cancer is involving the entire breast along with more number of lymph nodes. Chest wall is not involved. Definitely it can be treated. Advanced is the stage where disease becomes systemic spread. That is more other than the breast. These patients will have disease in any other place, either to the bloodstream or to the lymphatic system. That is spreading the bone, spreading the liver, spreading to other organs. This becomes stage 4 disease. As I said, if he or she comes in stage 1 disease, early stage 1 or stage 2, we can, by giving proper management, we can give 80 to 90% of people can give it curing rate. That is, they can live more than 5 years. If they come locally advanced disease, their survival comes down to almost 50 to 60%. Whereas advanced disease, stage 4 disease, we are not bothered about as I told you already, we are not bothered about the quantity of life. We are bothered about the quality of life. Let them live the same number of years or same number of time, the life expectancy. But let them have good quality of life. Definitely quality of life will improve with present modality of treatment. This is why way back in 90s, late 80s, we opened a palliative care unit in our cancer institutes. I am here proud to say that Kidwai is the first institute to develop Department of Palliative Care in the Government of Karnataka, a separate department to take care of advanced cancer patients. Especially country like India, In spite of education, awareness, government program, institutional program, still 40 to 50% of people come with advanced disease. All of them need one stage or other palliative care center. Okay. This is what broadly I want to talk about breast cancer. Anything else? That should be enough, I think. Let us interact. Anita.
Thank you, sir. Thank you so much, sir. So, can you explain our delegates regarding the breast self-examination, when it needs to be done and all those
Yes,
things?
yes. See, again, in screening and education, we always tell people, not necessarily, especially people about 30, 35 years, especially people who had family history of breast cancer or any other cancer in the family, they should be, all of them need not go to a doctor in the beginning. A good self-examination of the breast is more than enough. Wherein average intelligent lady can definitely detect. I always tell people, while taking bath, apply enough soap solution on your breast. Just palpate with the pulp of the finger. Don't hold with the tip. Palpate with the pulp of the finger. If you feel anything, lump or any hardness, any discharge, then you have to go to the doctors. Every patient for screening need not go to doctor early stage, especially common population. Only people with high risk cases can go to early stage. See, the self-examination can definitely eliminate. Will definitely 80% people can be diagnosed for the suspicious lump. They can go to the doctor. Okay, this is what self-examination. Okay, now you do self-examination at your home. You feel there is some suspicious, some granularity, some discharge, some nipple retraction, some ulcer, some eczema. Then you go to screening. Definitely at this stage, a doctor will help. All the patients who have got a lump, they like to do initially mammography. Mammography, when you have a lump, they can always tell when already somebody felt a lump, why should you undergo mammography? Mammography, even after lump, you need because there is what you call multicentricity or multifocal origin should be there. Or you should examine other breasts also. So a bilateral mammography must to increase to detect multicentricity or multifocal development. Opposite breast also. Once screening shows some suspicious knowledge, then we think of further evaluation. That is either a biopsy, excision biopsy, or fine needle aspect. Depends on the facilities available, institution focus, and the patient requirement. This is much better than, and it is not, this is very cost effective. For all this, up to this, what I explained, patient need not spend thousands of rupees. Okay, in a few hundreds, you can be done. Further treatment depends on the stage of the disease, available facilities of the patients, or history of the patient, age of the patients, and the city or center what's available for you. But by and large, I think this should be the broad outline for management of breast cancers. Okay, Anita, anything else you want?
Thank you, sir, for answering your question. So, one of our delegate had one doubt, sir.
Yeah.
I kindly request our delegate to put forth the question to the speaker.
Yes, please.
Good afternoon, sir.
Yeah.
Sir, my
Yes,
question
this
is,
is from a man.
what are the chances for males for
Yes, you are talking about male
having breast cancer,
Yes.
sir? And what are the causes for them?
Yes. There are chances of 1%. If you see, I told you about 30, 1 in 30 female born, Indian born female child have breast cancer. There are chances 1 in 100 male can have also develop breast cancer. Not that male cannot develop breast cancer. Breast cancer in male is quite rare, but it can develop. The problem with breast cancer in male is, the subcutaneous tissue, fat are very close to chest wall. The moment cancer affects the male breast, it gets stuck to the chest wall. This is why usually most of the cancer male patients come with advanced disease. There's not much of bulk, there's not much of breast tissue. Management is same. Okay, with the stage of the disease, age of the patient, the facilities available. This is not that breast cancer in male is not that common, but can occur. Are you clarified? Yes.
Yes, sir. Thank you, sir.
Thank you.
Any other queries from the delegates?
Good afternoon, sir. afternoon, sir.
Good afternoon.
Sir, I just wanted to know how common is breast cancer among young girls now?
Young girls in the sense teenagers, sir. What
Yes.
exactly means young
Not
girls?
married, unmarried girls.
Unmarried, see, unmarried girls in the sense, unmarried girl could be 40 also, unmarried girl could be 20 also. Okay.
Yeah, in the age of 20 to 30,
One
sir.
thing, I tell you, how do you go about it? Especially if you have family history of cancer, especially more so families of breast cancer, these people should be more careful. Maybe I always felt they should undergo screening around 18, 19 itself. They should start preliminary screening. Parents should see one thing. Bringing awareness, education different. Don't bring scare or fear in the brain. Just because your mother had breast cancer, just because your family, your sisters or elder sister or some cousins have breast cancer, doesn't mean patients should get unnecessarily worried about it. Only thing they should be more careful. As soon as early as possible, say 18, 19, let them start self-examination. If self-examination breast feels slightest doubt, then you go to consultant. Okay. For further evaluation. Otherwise, I don't think they need any extraordinary care for. More so, we give. See, I tell you, for this, you should know what is the incidence of cancer occurring. What is the increase incidence of family history of breast cancer? They always tell if your lady develop premenopausal breast cancer, the chance of her family members is double the general population. If somebody in the family develops premenopausal breast cancer and bilateral breast cancer, it becomes double or triple compared to general population. This is where the awareness, education, self-examination counts. Okay. All these people should be alert, aware, and see that they go for early detection. I think your question is answered.
Thank you, sir.
Yeah.
Thank you, sir. Any other delegates have any queries? You can ask your question to sir.
Sir,
Yeah.
if a woman feels a lump, like first instance, either biopsy or FNAC to be done, sir. Like FNAC, if you do know, like they are saying like fine needle biopsy should not be done.
Why?
So
No, there's no specific contraindication for fine needle aspiration. Okay. If fine needle aspiration comes as non-contributory or that they cannot count it, sometimes it's very difficult to fine needle because fine needle aspiration don't represent the entire lump in the breast. It just takes few cells. If fine needle comes as non-contributory, they will say sometimes doubtful malignancy. Such people has to undergo excision biopsies. Okay. Yes.
thank you, sir.
Any other queries from the delegates?
Yeah. Yes.
Query from Prema, ma'am. Ma'am, you can ask to sir, ma'am.
Yeah, Dr. M. Premi.
Yeah.
And
Yes,
like
yes.
this breast cancer, what is the age span? Like, is it, is it below 40 or below 60 or something like that? Once we cross 60, what are the chances?
See, I have seen breast cancers as younger as 15, 16 years. I have seen breast cancer development above the age of 75 also. Incidence may change, but nothing assures. Age doesn't give assurance that that patient will have more of this patient. There are chances. Definitely. See, now, in other ways, we always tell breast cancer in India has become more because of aging population also. Cancer incidence increases because women aging population also increasing. You cannot quantify, you cannot specify, or you cannot exempt because you cross 65, you cannot get breast cancer. Okay.
Okay.
You can get breast cancer at any age.
Okay. So, other than this, what I want to know is, suppose we are not able to feel the lump in the breast.
Yes.
Is there any other blood test which will tell us, yes, some cancer cells are growing somewhere in the body?
No, you are going one step ahead. Definitely, there's a lot of experiments are going on for that sort of detection, but still clinically and national programs, it's not viable to have such extraordinary tests. Okay. By and large, screening is enough. Very 99 point of patients can be diagnosed with screening only. So that's what I insist. Even now, I feel good self-examination is much, almost 70 to 80% can detect. Only 20 to 30% patients, even with early detection, they are not able to detect. I mean, self-exam, they are not able to. Such people need a doctor's good examination and a mammogram.
Okay. Like why I wanted to know is like there is some blood test like other tests. No, we are diabetic and all those things. Any test which tells yes something is there in the body, whole body.
As and today,
Nothing.
100% specific.
Okay. That's all.
Like that.
Thank you, ma'am. Thank you, sir.
Naveen, am I audible?
Yes.
Yeah.
Dr. Lingegowda here.
Yes, sir.
Yeah. See, first of all, let me congratulate RV College of Nursing for choosing such excellent speaker, because I don't have any words to say about sir. With nearing half century of experience in the field of oncology and coming for this small program. And I should tell you guys that he must have operated more than a million patients. And as he said, he has started his journey in 1980. And my request is, after listening to his lecture for half an hour, each one of you should become a guide to tell others that how to do the self-breast examination. In fact, one of my colleagues who's a practicing anesthesiologist, when she was teaching others, she herself detected a small nodule and got operated, got treated in Kidwai, and after almost she's completed 8 years. Why I'm telling this is, cancer, the moment we hear cancer means, we'll say that no, it's a dreadful disease, it is death. It is not so. In fact, Professor Prabhakaran sir always says that cancer is a good disease because it is curable, provided it is detected in the early stage. Sir, I'm extremely thankful to you, sir, for addressing all these people. Thank you.
Thank you, Dr. Gowda.
Thank you so much, sir.
Incidentally, I want to tell you, Dr. Lingegowda was chief of palliative care in Kidwai. It was the first department, a separate department of palliative care started in India.
Wow, it's nice to hear, sir. Thank you.
Because they really was anesthetist basically, wherein we promoted him as a palliative care man. Definitely, they're doing a lot of job for advanced diseases.
All because of you, sir.
So, one more thing. If you believe in yourself and have dedication and pride, never quit, you'll be a winner. The price of victory is high, but so are the rewards. Now, I kindly request Dr. Lingegowda, sir, former registrar RGHS, to address the beautiful gathering, sir.
No, I don't have anything after sir has addressed the gathering. In fact, see, both me, in fact, today, if at all, if I have achieved this level, means it's because I've learned several tricks from Prabhakaran sir. When he was director, when he was honorable vice chancellor of such first university of the country, Rajiv Gandhi University, he always used to take everybody together. Usually the people always, you people, the problem with nursing community is you think that you are number 2 or number 3 citizens. It is not so. In fact, even the present INC chairman, Dr. Dilip Kumar, I'm in close connection with him. See, Dr. Prabhakaran used to take nurses always together for all his functions, because he was used to tell when he was supposed to operate. I have seen him hitting our nurses when they don't assist him properly, because they have learned so much. And I'm sure you people definitely can make a significant impact. Of course, doctors alone cannot reach the entire community. So it is the responsibility of the nurses, social workers, everybody, when we join as a team, as sir said, together everybody can achieve more. So in this regard, I am extremely happy to be part of this webinar. Thank you.
Thank you so much, sir, for even sharing your valuable words, being a palliative care specialist also. Thank you so much. Any other queries from the delegates?
Hi,
Namaskara, sir. Namaskara, sir. ಸರ್ ಡಾಕ್ಟರ್ ಪ್ರಭಾಕರನ್ ಸರಿಗೂ ಮತ್ತೆ ಡಾಕ್ಟರ್ ಲಿಂಗೇಗೌಡ ಸರಿಗೂ ನಮ್ಮ RV ನರ್ಸಿಂಗ್ ಕಾಲೇಜಿಂದ ಸರ್ ನಮಸ್ಕಾರ ಸರ್.
Namaskar, namaskar.
You are so busy. You have given your valuable time for our webinar, sir. Really, it is indebted, and You are giving valuable information for general public. What best way we can go ahead with the palliative measures, especially for cancer patients, as well as preventive and curative. Even we have more than 151 delegates here, sir. Even in future, we need your supports to bring good level of awareness uh, in terms of preventing cancer, sir. Thank you. Thank you very much, sir. Thank you, sir.
Thank you. Yeah.
Thank you so much, sir. Any other queries from the delegates?
Hello, sir. It's me, Dr. Geeta.
Hmm. Yes, Dr. Geeta. Yes.
Sir, is there any chance of getting cancer, like if the woman has got undergone total hysterectomy in her early 30s, is she
Yes.
more prone for getting the cancer? If she is, and what are the preventive care she can take?
No, only breast, only, if she's undergone hysterectomy for a non-malignant condition. Okay, most probably what you're telling is non-malignant condition. I don't think there's any increased risk. If at all she undergone for a malignant condition, definitely her body is prone for cancer. You have to be a little more careful. Not that incidence increase, you have to go for early detection. I don't think per se hysterectomy, especially country like ours, rural side hysterectomy is a very common surgery. Does not increase. As a matter of fact, urban side there is increased incidence of breast cancer. Rural side, in spite of lot of general surgery chopping off most of the uterus there, I don't think it gives any increased incidence at all. Only when these people are, if in case they are operating for endometrial cancer or ovarian cancer, definitely hormone-related cancer to some extent do not measure. It may be related to other hormone-related cancer, especially the same organ like breast. You have to be more careful or more aware. I don't think I will give any special precautions for that. Again, self-examination.
Because after hysterectomy, because women will have hormonal
This is what I
imbalance.
always said. Postmenopausal women, hormonal treatment, definitely they feel there is a slight increase in chance of getting breast cancer. These people should not go proper early detection, self-examination, go for screening. They should make it at least first 1 year you do screening, then every second year you can do mammography. Go for early detection. That's all. I don't think you need extra caution for that.
Thank you, sir.
Doctor, just in continuation with the SARS advice, most of the things are stress related. You must have observed Dr. Professor Prabhakaran in last 25 minutes, all the time smiling. See, he never carries any anger or grudge, but just keep happy. That, in fact, the most of things are stress related. Keep happy, enjoy the life. That solves most of the problems.
Okay.
Thank you, sir. Thank you so much. Dear delegates, any other queries to sir? Yes, Namita?
Sir, actually, I want to know if there is any vaccination for breast cancer. Is upcoming.
No, it is.
It will come.
It is all in the experimental stage. It's all in experimental stage. Still, it is not commercially or in a broader way used. It's all still in the experimental stage.
Okay.
Thank you, sir.
Thank you, sir. Thank you, Namita. Any other queries from the delegate?
For the sake of others, can I talk, Pramila?
Yes, yes, sir.
For the sake of others, some people have hesitation to ask in the open meeting about any queries or the doubts or the clarity. They can always, I think I give them a number. You can always contact me. You can not hesitate. Personally, they want to talk about many people don't like to talk in the open. They can always contact me for the clarification.
Yes, sir. Thank you so much, sir. Any other queries from the delegates? Okay. So let's have a short video which is related to the early onset of breast cancer, risk reduction, what are all the warning signs. Just look at the small video.
Yeah.
Whether your risk for early onset Hello, I'm Dr. Maya Hatton. Thanks for joining us for our video, Early Onset Breast Cancer Part 2, Risk Reduction and Warning Signs. If you haven't seen
Thank you so much, media team, for showing us such a wonderful video on risk reduction and warning signs of breast cancer. Thank you, ma'am. The most beautiful way to start and end the day is with a graceful heart. My request Ms. Farnaz Begum, second year MSc Nursing student, RBCN Bengaluru, to set the food to propose vote of thanks.
A very good afternoon to all, and thank you, Gautami ma'am. Thankfulness is the quickest path to joy. Honorable dignitaries, faculties, and students, I deem it a great honor and privilege to propose the vote of thanks on this event. First of all, I thank God Almighty for making program a resounding accomplishment. It is my utmost honor to thank Dr. P.S. Prabhakaran, consultant surgical oncologist, Maya Multispeciality Hospital, Jayanagar, first floor, Bangalore, who consented to be the chief guest and eminent speaker of today's event for gracing the occasion and sharing the knowledge on breast cancer, its causes, incidence, screening, and educational program, despite his busy schedule. I wholeheartedly thank you, sir. Next, I also thank Dr. Lingegowda sir, former register RGUHS, palliative care expert, for gracing our webinar in spite of your busy schedule. I thank you, sir. Next, I would like to acknowledge my gratitude to our principal, Sir Dr. S.R. Gajendra Singh Sir, for his valuable guidance and constant support for making this event a reality. I wholeheartedly thank you, sir. I also extend my sincere thanks to Professor Mamta N, HOD of Department, MSN RVCN, for her valuable contributions and support throughout the program. I thank you, ma'am. I am grateful to all the HODs of various departments, faculties, and staff of RVCN for your presence in today's event and for patience listening. My profound gratitude to you for you all. Next, my heartfelt gratitude to all the participants of today's webinar for their presence. I hope that this webinar was a fruitful event and you all benefited much from it. Thank you all. I finally thank the organizing committee for all their efforts. Thank you one and all. Have a good day. Over to you, ma'am.